Hey folks, this is Liam from Compliancy Group. Hopefully everybody can hear me. Thank you for those of you who have hopped on here a little bit early. We're going to be getting started in just a couple of minutes here. I want to give everybody a little bit of extra time to get on, just simply because GoToMeeting, with the high volume of people working from home in the current climate, actually has been crashing an awful lot for a lot of people. So I want to make sure that everybody has plenty of time to be able to get in. So we're going to be getting started here in just a bit. I'm seeing that the attendees are now starting to pour in, which is good. Should mean that everything is working appropriately. I hope everybody is doing well with the current pandemic that is sweeping the globe. I know that it's been more than likely a lot to deal with. Everybody is feeling the impact of this in large ways and small. Those of you who are in the context of healthcare, I am sure things are either dead if you are in a particular specialty that is people are not necessarily going to right now, or things might be incredibly busy if you're in the middle of what might be primary care or urgent care or your hospital group. So hopefully everything is going well wherever each of you are, even our own business. Things have been a little bit interesting lately. I am doing the webinar from home today, so it's been an interesting time for sure. I'm seeing we've got a bunch of people on, so with that said, we can go ahead and get started for the purposes of today. To kind of set the stage here, my name is Liam. I'm our Senior Account Manager here at Compliancy Group. What we're going to be discussing today is not even necessarily the benefits of HIPAA compliance from the perspective of just passing an audit, but getting a little bit under the hood of some of the HIPAA requirements and understanding the impact that that can make directly on your practice, your business, company, or organization in terms of how having a compliance program in place can both impact the way that you operate very positively, leading to more profit, or just improved operations, happier employees, and of course, happier clients and happier patients as well. So we hope that this is beneficial as we go through here today. This is data that we spent a lot of time unpacking, both with clients of ours that we have set up compliance programs with, and just overall industry expertise. Now, one thing to keep in mind, and I'm just going to make sure, so one slide that's actually missing here is the fact that all of our previous webinars are recorded. This webinar will be recorded as well. If you would like to have a recording of this webinar, you don't have to ask a question in the actual GoToMeeting. You can actually just reach out to, you can go on compliancygroup.com/webinar and request access to our webinar archive. And once the recording is completed, you'll have all of that along with access to any of our other webinars. We also have a ton of free educational resources on there for you to utilize. So things like a simple HIPAA checklist as a one-page overview of the requirements of the law, infographics that you can use as a general point of reference for certain things as far as the HIPAA rules go, okay? Lots of different things in there, our blog, white papers. Definitely feel free to check that out. We'd be happy to provide you with those resources, and do not hesitate to ask questions as we go through here today. GoToMeeting has a very specific question and answer feature where if you send in any of those questions that come up as we go through, I'll be able to address it at the end of the webinar and just hopefully make sure that everybody gets the information that they need before we hop off today. Now, to just give a little bit of background information on our company, this is always where we like to begin with a webinar, because at the end of the day, anybody could read a book about HIPAA and then come and start talking about it and put out material about it. That is not the case with us, okay? We have been in this industry for over 15 years, okay? If we're talking about the scope even of our company, we have clients in 34 countries, all 50 states, okay? And we are the endorsed solution of over 40 different medical associations and specialties, because in the history of our company, we have never had a client fail any type of a HIPAA audit, investigation, or be fined. Okay, we have an extensive subject matter expertise as it relates to HIPAA. We have never had a client fail any type of a government audit. So that knowledge that we have, we really want to take, and we put a lot of it out there into the market completely for free. Just because our whole philosophy is to take some of these, what can be, of course, very complicated issues, very cumbersome law, and simplify it so that you have the resources that you need to confidently focus on doing your job. All right, so that's a little bit of our background, just to give some context here. And what we find concerning HIPAA, and to kind of lay a little bit of groundwork here foundationally, even on just what HIPAA is, period, okay? We see a great deal of misunderstandings concerning HIPAA compliance within the market, just because of the role that we serve. And one of the biggest ones is things, and I'm going to unpack all of this in just a second, but compliance versus security is a big one. Okay, we'll speak with a lot of companies that think compliance equals technical security. Okay, and while technical security is certainly a function of the regulation, okay, it is not the end-all be-all of the HIPAA requirements. Okay. We'll have other people that are focused, that maybe have some confusion around high tech, meaningful use, MIPS, the omnibus rule, which is the newest of the HIPAA rules, passed and relates directly to business associates. All of these different things, okay, that people can kind of get a little bit sideways on from a HIPAA perspective. What we really want to bring out here, okay, is when you think about security, even when you think about certain aspects, so like training, policy and procedure, lots of the different things that we typically think of when we think about HIPAA, each of those things are certainly a function of the regulation, okay? But the actual HIPAA regulation itself deals with a very specific set of annual requirements that need to be satisfied as part of what the government calls an effective compliance program, okay? And really, so foundationally from a HIPAA perspective, just to kind of go over a few of these things very quickly, those elements of an effective compliance program in terms of the annual requirements, beyond just being secure, or okay, beyond than just having policies or doing trainings, most foundationally is what's called a risk analysis, okay, which is those audits that you see there in the wheel on the right. The HIPAA risk analysis breaks down into several different areas covering things like your IT security, like your policies and procedures, your physical location, okay? But that risk analysis makes the basis for how you then document, track, and evaluate each of those things on an annual basis. It's why the government has it required. If you are doing that risk analysis once per year and doing it properly, you will be identifying your gaps in every other possible area, because in conjunction with that risk assessment is, of course, then that you are identifying your gaps and that you have clearly documented remediation plans that explain how those gaps are going to be filled in. Because, of course, just doing an assessment can certainly be helpful and it's required, but that assessment means absolutely nothing unless you can then prove how you actually filled in the gaps that were identified as a result of that assessment, right? Many of the things identified could be from an IT perspective. We find for most companies or practices, the overwhelming majority of those remediation plans will come back to implementing things like proper policy and procedure documentation, which the government then requires to be reviewed and updated annually. You want to make sure that you're documenting that. Training the staff, right? That you can prove that the staff has reviewed and agreed to your policies and procedures. That you're tracking your vendors, okay? Making sure that you are vetting your vendors. There was a small it was a solo practitioner, gastroenterologist, that was fined $100,000 2 weeks ago for not properly vetting his EHR when they had a breach, okay? Managing any incidences and reporting them in accordance with the breach notification rule. The only reason I'm taking this little bit of time to comprehensively hit on some of those annual requirements is because if you are over there on the left, what we would call HIPAA Lite, you might be doing a security risk assessment, maybe missing the administrative and the privacy audits. You might be doing some remediation as from an IT perspective. You might have some policies and procedures and training. Understand, HIPAA is entirely binary, okay? Meaning that there's no such thing as being mostly HIPAA compliant or partially HIPAA compliant. It's a pass or a fail type of a thing. And what you see there, HIPAA Lite does not exist. Okay, in the eyes of the government, you are either HIPAA compliant or you are not. In the event that that is all that you have, you would certainly fail an audit. Okay, and we don't say this in the realm of scaring people. We say this in the way of it is extremely important, especially with the way that the government is enforcing HIPAA nowadays, to make sure that you are comprehensively have a means of addressing these things. Now, with that kind of groundwork laid, what we want to talk about is how if you are satisfying the HIPAA requirements completely and in an effective way, the actual benefits that it can have on your practice, your business, or your organization really are tremendous, okay? Because foundationally then, in the event of a government audit, okay, what you see there at the bottom, you'll pass your audit, right? You won't be fined. You won't get stuck inside of a settlement with the OCR and having to be reporting on all of these things year over year over year, right? But then what actually is really probably even more important than just making sure that you could pass an audit is that it creates an impact on your company and on your practice, whether you are a healthcare vendor or involved in healthcare yourselves, where you'll actually keep your patients, right? If you can not only be addressing and fully satisfying the HIPAA requirements, but being able to communicate that in a way that makes your patients feel comfortable with you, it'll go a long way from a retention perspective, which has a tremendous impact on your bottom line as a practice, okay? Statistically speaking, if you are implementing a compliance program, it leads to happier employees, because you then have everybody reading from the same playbook, following the same rules, receiving the same trainings, which really standardizes your operation, leading to actually not only happier employees, but then satisfied clients and patients, because everybody's going to be receiving the same level of service. Statistically speaking, practices that are compliant and secure are 15% more profitable than ones that are not. Okay, and you see all of that come in with number one, you're improving efficiency, people will be happier, implementing those policies and procedures. There is a lot more to this than just from looking at this from the lens of, hey, if I don't do this, the government is going to audit me, I'm going to get fined. Okay, if that's all the only way that you're thinking about this, you're not going to wind up getting a lot of the beneficial things that you could get out of having an effective compliance program. Okay, and really, a lot of this also, more than just the operational benefits, it's the fact that it's going to protect your reputation, right? And you'll see some of the statistics as we go through here, but you don't want to have come up when somebody looks up the name of your practice is the HHS wall of shame, right? Because all breaches of more than 500 records or any open investigations are all public records. So you can even look up OCR wall of shame, and you might see a bunch of practices, companies in your own town that have had breaches or are currently under investigation right inside that breach portal. You can check that out there. Because what this is all about, okay, in the realm of reputation management, is staying ahead of the curve of what your patients are hearing and seeing about the healthcare industry in the news, right? Because what they're hearing is not good. Okay, roughly 17,000 medical records are breached per day on average. 89% of healthcare organizations would say that they have experienced the breach over the last 2 years. They're seeing the fines levied in the news, right? They're hearing about the breaches and the issues and the privacy violations that are happening. And where your greatest risk is, okay, is your people. 86% of the breaches that happen in healthcare are not at the fault of failing technology, okay? It's usually failing people. Human error, right, and administrative issues is what accommodates for the overwhelming majority of these mistakes. And compliance, okay, and not necessarily security, okay, not necessarily better IT, but actually training your people, educating them, implementing a program that standardizes these types of things is what really compliance is designed to do, to limit those administrative errors as much as possible. That's why this is so important, okay? Because if we're looking at this not only from the way that it can impact your company, but think about the way that your patients see you and the way that they feel about HIPAA, okay? When a survey was taken it was a survey actually done of over 500 people that have been victims of identity theft, okay? When asked, are you confident your healthcare providers protect your medical records? 68% of them said that they were not confident, okay? When asked, did your provider's negligence cause or contribute to your identity theft? 53% of them said that yes, they caused or contributed to it. And do you know why? There are very, very, very few organizations, okay, that a typical patient will be coming in contact with that have more information about them than you, okay? Right now, healthcare is the #1 cyber predator target. 33, or I'm sorry, it's well over 50% of all ransomware attacks are levied against a small to mid-size healthcare practice, okay? A single healthcare record can be sold on the black market for between 5 and 10 times more than a credit or debit card number. And do you know why? Because where a credit card or a debit card number can get somebody a quick transaction, okay, or quick funds before somebody's card gets canceled, okay, or before the transactions are canceled or everything is disputed, right? Having access to somebody's healthcare records in that way can be used for anything from identity theft to blackmail to any number of possible ways that a predator could leverage that information to make a whole lot of money, meaning that the information that you have about your patients is tremendously valuable, okay, making it very, very vulnerable if you're not addressing these types of things. And even in the realm of these benefits, right? So if we're talking about staying ahead of that curve, being able to not only address the HIPAA requirements, set up privacy and security programs within your practice, that's a great thing to leverage even on things like social media, okay? Because with the way that the world is turning today, people go online. Okay, we have a very interesting environment right now in the context of healthcare, which is that people are approaching their healthcare more and more and more like consumers, not like patients. Okay, and what I mean by that is that if I'm a patient, okay, and I have access to a doctor, I go to that doctor because he's the one who can help me with the problem that I have. Okay, if I'm a consumer, okay, so like let's say Netflix, okay, if I am a consumer, I might be using Netflix, okay, but if I, for one reason or another, I'm not happy with Netflix, I might go to Amazon Prime, I might check out Disney Plus, I might try Hulu, I might try any of these other streaming services to get a better experience, and more and more and more the healthcare industry is shifting in that direction, where people are moving and bouncing around trying to find, okay, a better patient experience, much more like a consumer, okay, than has ever been seen within the healthcare industry. And being able to leverage technology and things like social media is a very powerful way to get ahead of that curve, okay? 72% of people will go online as the first step to finding a new doctor, okay? Most people, again, are hearing about the negative impacts of this in the news. So if you can have, even on your website, clear and concise information about what your practice is doing to protect your patient's information, if you can leverage even online review sites like Yelp and Google and Facebook to be able to do this effectively, okay, even something like a seal of compliance on your website has been shown to yield a 17% higher increase in terms of new patient acquisition than doing nothing, okay? And what is interesting with this is that all of this, okay, we're having this conversation about the benefits of HIPAA compliance, but even from the perspective of HIPAA, yes, it's good for business, but it's also legally required, okay? And just by you doing, not going above and beyond what is even necessary, but just satisfying the requirements of the law, it creates a ripple effect throughout the rest of your business, helps you retain patients like what we were saying before. And some data that you might find very interesting is that on average, it costs a practice 6 to 7 times more to gain a new patient than it does to simply retain the ones that they have right now, okay? So those are the types of issues that compliance can really help with through the standardization process and through implementing some of these things. And before I keep going here, I do see that we had a question that came in, so I just want to make sure if it's something pertinent to what we've been discussing. Okay, so somebody was asking if we're having any audio difficulties. I haven't received any other questions concerning audio. This came from Andrew. I apologize if you're having difficulty hearing anything. I'll make sure personally that you get the recording of the webinar when we're concluded here today. Where in the HIPAA rules does it list out or discuss the 6 required annual audits that this speaker spoke about? Okay, so what HIPAA is going to refer to is what's called a risk analysis, okay? And in the actual HIPAA rules, what they break down that risk analysis as being is the technical, okay? Your risk analysis has to cover the technical, physical, and administrative requirements of HIPAA, okay? In the realm of addressing those requirements, what it usually needs to be handled on the technical side is, first of all, assets and devices, right? Making sure that you have a clear log of devices that you have in your practice and how those are being protected. Following the fact that you have those assets and devices logged and how they're being protected is then what's called an IT risk analysis, okay, which is of your overall network, your server, your firewall, all of those types of things, so that from a security perspective, as it concerns your IT, everything is established, okay? Those are your first 2 audits. If we're talking about the physical requirements, there is then the physical site audit, and there are 3 administrative audits which relate back to the HIPAA rules, okay? So you have privacy standards, dealing with your privacy policies, security standards, which deal with your security policies, and high-tech subtitle D, which is actually an audit concerning things like breach notification, okay? Those 6 audits are what address those technical, physical, and administrative components that the government wants to see, okay? And then, yeah, so I think some people have been having technical difficulties, and genuinely, I think that because of the high volume GoToMeeting has been experiencing, with a lot of people working remotely and doing webinars and presentations through platforms like GoToMeeting, some of you may be having audio issues. If you need the recording, go ahead and ask for it, and we'll make sure that gets over to you along with a copy of the slide deck. All right. With that said, just wanted to make sure that we addressed some of those questions that came in. We'll keep going with the rest of this, okay? In the realm of what we were talking before about retention, right? Being able to leverage some of these things. There's some very interesting statistics here. First one, 20% of patients are lost by average practice annually, okay? Meaning that if you have 100 patients right now, you're going to lose 20 of them, more than likely by the end of this year, okay? 68% of practices, okay, in terms of new appointments that come from existing patients, okay? Meaning that in terms of new appointments for people that you have coming in, okay, 32% of them are actually new patients, not even ones that you've had already, which kind of begs the question about why that number is not reversed, right? Why you don't have significantly more new patients that are booking appointments. 83% of patients would recommend a practice they trust, and 82% of patients would say that they will stick to a practice if they trust it, right? And only if they trust it, okay? So you could be maybe possibly falling apart in every other capacity, but if your patients trust you, they have very, very good reason to stay with you. So it becomes more and more important to leverage those types of things. Because what really makes patients loyal, and I apologize, I'm seeing significant amount of questions coming in. Just want to make sure. Okay, yep. We will make sure that we get everybody the recording. So go ahead, keep submitting those requests if you need it. I will make sure that those get to you by the end of the webinar. All right. A couple of things here to talk about before we wrap up for the webinar today. Okay. First thing, what makes patients loyal? Okay, and this is not even from the perspective of healthcare. Okay, these are actually 5 key predictors that some of the biggest brands in the United States and the world are using. So brands like Nordstrom, Starbucks, Disney use things very, very similar to compliance programs to keep people coming back to them. Okay, and building that brand loyalty. First is overall satisfaction. Right, so are they happy first and foremost with the services that you provided? Second is your reputation. Okay, so think about the community that you are serving in. Okay, where before or in a kind of an older world, the community that you were serving in would talk and discuss it, and a lot of people in the same town would be seeing the same doctors. It's not necessarily like that anymore. Okay, your reputation has gone online. So maybe if you're not sure about what your reputation looks like on the market, just look up your practice on Google. See what your reviews look like on Yelp, what your Google reviews are, what people say about you on Facebook, and then make practical changes so that you could start to fix some of those issues if you see anything. And then number 3 and 4, okay, and 5 all relate back to your staff, okay? So number 1, the services that you provide. Number 2, your reputation. But then 3 out of the 5 key predictors of patient and brand loyalty relate back to the way that your staff handles your patients and your clients. Number 3 is satisfaction with problem resolution, right? So when something goes wrong, how was it handled? Okay, because things go wrong, it happens. Nobody will usually leave you just because a problem occurred. They leave you because of how that problem was handled and how it was addressed, right? Number 4, staff following through with what they say they will do, okay? Again, this comes back down even to standardizing your operation, policies, procedures, making sure that if somebody says that they're going to do something, that it gets done and that it gets done the same way every single time. Staff treating patients with dignity and respect, right? All of these things, okay? Again, some of the biggest brands in the United States are using compliance to do this effectively. The document that you see here on the screen actually comes directly from the Office of Inspector General and Health and Human Services, and it relates, and it is actually called the 7 fundamental elements of an effective compliance program. And so if we look through each of the 7 of these elements, you can actually see the way that some of these things could impact your practice. But let's talk about it in the context of somebody like Starbucks, right? Do you want to know why Starbucks is so successful as a brand and as a company? It's because I can fly, well, I'm not going to be flying right now with the virus happening, but for all intents and purposes, I could fly to Los Angeles, okay, and order a cup of coffee from a Starbucks. And then I could fly back to New York, go to a completely different Starbucks location in a completely different state with completely different staff, but order that same cup of coffee. And my cup of coffee is not only going to taste exactly the same as it did in LA, I will receive a remarkably similar level of customer service. Because what Starbucks has done across their entire organization is first, they have in writing policies, procedures, and standards of conduct that everybody is expected to follow, okay? That is what compliance requires, right? More than just having those in place, they have designated a person to ensure they are followed, right? They have a manager at each location, making sure that those policies are abided by, just like HIPAA requires that you have what would be a compliance officer that is responsible for making sure that those rules are followed. Conduct effective training and education, right? Starbucks trains their staff. And then number 4, develops effective lines of communication. Lines of communication, what that means is that what is decided on at the top, okay, from the C-level executives all the way to the brand new person getting started in one of their locations, they have come up with a plan, and they do it very effectively, where what is decided on at the top gets disseminated down to the people all the way at the bottom, okay? If those lines of communication don't exist within your practice, okay, there's going to be confusion. Things that you think should be happening will not be happening, and overall the standardization that you would like to have happen will not be there, okay? Those two things have to be happening. They monitor it, right? They audit it. They make sure that these things are being kept in place. They enforce these standards through well-publicized disciplinary guidelines, and they respond promptly if there's a detected offense, okay? That is what Starbucks does, and it is what they have used to become an extremely successful brand, but that is nothing more and nothing less than what the law requires you to be doing on a daily basis anyway for the HIPAA requirements, okay? There's a lot that you could be benefiting from here if you take this seriously. And even to talk just quickly before we finish up here about something like that seal of compliance, a study that we did with Doctor.com showed that that seal of compliance actually leads to a 17% higher conversion rate in terms of patient acquisition, because it's a very simple and effective way for you to be able to show your patients that they can trust you, that you take compliance seriously, that you have gone through the process of addressing your privacy and security needs. You'll even see that seal of compliance on a company like Phone.com's website because they leverage it to let their clients and their practices know that they're going a step above and beyond to make sure that they're addressing these things as is required. So at this point in time, I hope that everything that we discussed today was helpful and beneficial. Again, we're trying to get a little bit under the hood here in terms of some of the benefits that people don't typically think about from a compliance perspective and the way that this can impact your practice and your business, not even from an auditing perspective, but from the perspective of your bottom line, just helping you become more profitable. If there's any additional questions, please feel free to submit those now. I'm seeing a bunch of requests for the recording, so we will absolutely get those out to you. If anybody else has other questions concerning HIPAA or compliance, or even things like social media that we were mentioning before, please feel free to ask that now, and I'll do my best to address it. All right. We are not getting any more questions. So I hope that everybody stays safe, stays healthy. If you're like me, you're working from home. I hope everybody is productive, and hopefully soon this crisis is behind us. If you need anything, please don't hesitate to reach out. All of my contact information is right up there. Okay, I'm going to leave the meeting open for just a minute or two, so that if you want to copy down my phone number or my email and reach out to me with any additional questions, please do not hesitate to reach out. I'm more than happy to help whoever I can. All right. I hope you all have a wonderful day.